Friends, welcome again. Today I have brought a very important topic that is the injections. We doctors use injections in some cases when there is very much emergency. What injections we have to keep with us in a hospital? I will discuss about that in today's video. So, in this video, it will be discussed in detail the use of injection, its dose, and its where not to give, where to give in details. So, please see the video in details. So, without killing time, I am starting the video. I am Dr. J.P. Das, Director of Mausumi Hospital and Principal of National Institute of Medical Science. Let's start the video.
Number one drug is injection adrenaline. Adrenaline injection should be the primary drug in emergency tray drug list.
Adrenaline injection is a drug of choice in the cardiac arrest, which is pulseless. In pulseless condition, it may be given. In this condition, your heart suddenly loses blood flow and electrical activity.
Due to this, it may cause heart failure. Ischemic heart disease is most common cause of cardiac arrest. The dose of adrenaline injection in cardiac arrest is 1 mg IV route with a dilution of 1 into 10,000, that is 0.1 mg per ml. Adrenaline, also a drug of choice, is anaphylactic condition. In this condition, histamine level is generally increased. Due to this, it causes bronchoconstriction and vasodilatation. In anaphylactic condition, the dose of adrenaline injection is 0.3 to 0.5 mg IM route with a dilution of 1 into 1000, 1 is to 1000. If you don't respond after 3 consecutive injections, it needs to give 0.05 to 0.1 mg IV. Our next medicine is noradrenaline, norepinephrine. Injection noradrenaline is a drug of choice in cardiac shock. This drug is also belonging to the catecholamine class. As far as the concern, a dose of noradrenaline, it needs to deliver continuous IV infusion in range of 0.025 to 0.4 microgram per kg per minute.
Noradrenaline is strictly contraindicated in intramuscular route. Why? And subcutaneous also, because this drug has a higher chance of doing necrosis of the muscle.
Our number 3 drug is injection dopamine or dobutamine.
A higher dose of dopamine, 10 to 20 microgram per kg per minute IV, increases the blood pressure due to vasoconstriction effect. But a lower dose of dopamine, this is 5 to 10 microgram per kg per minute IV, stimulates the heart.
Our next drug is injection calcium gluconate.
Calcium gluconate is used in emergency condition like cardiac arrest and cardiotoxicity, which occurs due to hyperkalemia, that is the high potassium level, and also used in hypermagnesemia, that is when the magnesium level is high.
Our next drug is atropine.
It is considered the best antidote in cholinergic poisoning like mushroom and organophosphorus compound toxicity.
Our next drug is amiodarone. Amiodarone, if arrhythmia is occurred in your myocardia cells or ventricle area, it will call ventricular tachycardia, that is 125 to 250 BPM, and ventricular fibrillation over 300 BPM.
According to the published literature, in European Review of Medical and Pharmacological Science, suggested that the amiodarone is considered drug of choice in the pulseless ventricular tachycardia and ventricular fibrillation.
Our next drug is lidocaine, that is lignocaine. If the amiodarone injection is not available or considered for patient with a ventricular tachycardia and ventricular fibrillation, in case of lidocaine, in that case, lidocaine injection 1 to 1.5 mg per kg slow IV push is a perfect choice for treating ventricular tachycardia and ventricular fibrillation. Our next drug is adenosine. Suppose your ECG report showing arrhythmia above the ventricle in the atrium area is called supraventricular tachycardia. Supraventricular tachycardia is 4 types: paroxysmal supraventricular tachycardia, atrial fibrillation, atrial flutter, WBW of Parkinson-White syndrome. Adenosine is the drug of choice in supraventricular tachycardia. It is also effective in other types of SVT.
Esmosol injection is an alternative option for treatment of atrial flutter and atrial fibrillation and PSVT. Esmosol is an ultra-short acting drug. Its half-life is a minute. It starts to work within 60 seconds.
Our next drug is magnesium sulfate. As per a study, intravenous magnesium sulfate injection is a drug of choice of Torsade de Point. Our next drug is mannitol. Mannitol is highly effective osmotic diuretics. It is powerfully increase the urine output and excretes almost all the electrolytes like sodium, potassium, calcium, magnesium, chloride, bicarbonate, and phosphate ions. Mannitol is a preferred drug in emergency solutions like acute congestive glaucoma, shock, head injury, cerebral edema, and stroke. Mannitol also used in acute kidney failure. It is contraindicated in pulmonary edema, severe heart failure, and anuria. Our next drug is furosemide. Furosemide is a powerful loop diuretic agent. It inhibits the reabsorption of the following electrolytes, that is sodium, potassium, and chloride ions. It is used in emergency situation like pulmonary edema condition. Furosemide starts to work within 15 minutes after intravenous administration. The half-life of furosemide is 1 to 1.5 hours. Our next drug is injection sodium bicarbonate. Sodium bicarbonate is the alkalizer agent and it is a drug of choice in metabolic acidosis condition. Our next drug is phosphophenyltoin, phospholin. Phosphophenyltoin is an anti-epileptic drug. It is a producing phenytoin and is used in the treatment of status epilepticus. Our next drug is nitroglycerin. It is also known as GTN, glycerin trinitrate. Nitroglycerin injection is primarily used to treat your high blood pressure during surgery. Nitroglycerin is a short-acting nitrate and its half-life is 2 to 3 minutes. Our next drug is 25% and 50% dextrose infusion. It cannot be avoided from emergency drug list. It helps to overcome fluid loss from your body. Our next drug is snake antivenom. According to a study, snake antivenom is the only effective antidote in the treatment of snake bite. It reverses the effect of snake venom, and this antivenom is prepared by the poisonous snake's venom and horse serum. Injectio naloxone. This drug is mainly used in emergency condition when you are expected to opioid like morphine, heroin, etc. poisoning. Naloxone injection starts to give effect within 2 minutes when given intravenously. Our next drug is flumazenil. Flumazenil injection reverses the sedative effect of benzodiazepine. If you mistakenly overdose to benzodiazepine like diazepam, alprazolam, clonazepam, clobazam, etc., then you may have developed severe mental depression, ataxia, unable to make valence, and slurred speech, unable to speak. In that case, flumazenil injection is the best antidote. Other antidotes in poisoning are antidotes for alcohol, methanol, ethyl glycol, and diethylene glycol poisoning is fomepizole. Antidotes for a rat poisoning is by the rodenticides, vitamin K1. Antidotes for arsenic, gold, lead, and inorganic mercury poisoning is dimercaprol. Antidotes for dhatura poisoning is physostigmina. Antidotes for cyanide poisoning is hydroxycobalamin and sodium thiosulfate. Friends, we have come at the end of this video. I hope you have liked the video. If you have liked the video, please give a like. If you are new in this channel, please please subscribe this thing such that I can bring new videos for you, such informative videos. However, thank you very much for viewing this video. See you again in the next video, which will come within very short period of time. Bye bye.